To understand breast cancer, we first have to look at the normal architecture of the breast. It's essentially a network of milk-producing glands, all cushioned and supported by fatty connective tissue. But sometimes this normal cellular machinery breaks down. A small cluster of abnormal cells begins multiplying rapidly, clumping together to form a dense, localized mass, a tumor. If left alone, this mass does not stay put. The abnormal cells can break away, escaping the breast tissue and traveling into nearby lymph nodes, eventually spreading to other parts of the body. What starts as an isolated clump of cells becomes a systemic threat. Stopping that spread requires immediate, precise medical intervention. Long before anyone reaches an operating room, there are physical warning signs. Patients often notice painful swelling or an unusual stiffness in the breast tissue, which prompts them to see a doctor. Once a tumor is identified, the medical team gathers the patient's history and runs tests to map out exactly how far the mass extends. This diagram shows the clinical crossroads. It dictates two distinct pathways for treatment, one for a localized tumor and one for a cancer that has begun to spread. When it is time for surgery, the patient is brought into the operating room and placed under general anesthesia, remaining entirely unconscious for the duration of the procedure. As the patient sleeps, the surgical team follows the map they've built. The precise behavior of the tumor determines which of the two surgical pathways they will execute. If tests reveal that the tumor is confined to a single, specific region of the breast, the surgeons opt for a lumpectomy. They begin by making a small incision near the nipple, typically in the upper region of the breast, to gain direct access to the abnormal tissue. This diagram outlines wire-guided surgery. A radiologist inserts a thin wire, pointing straight to the tumor, creating an internal map. Following this path, the surgeon slides the tumor out along the wire, leaving the surrounding healthy tissue perfectly intact. The lumpectomy is an exercise in targeted precision, neutralizing the mass with minimal anatomical disruption. If the tumor has grown to encompass the entire breast, or if abnormal cells have migrated toward the surrounding lymph nodes, a lumpectomy is no longer sufficient. In this scenario, the surgical team escalates to a mastectomy, which requires the complete removal of all breast tissue. They do not stop at the breast. To prevent the cancer from traveling to other body parts, surgeons track the disease into the armpit and sever those transit routes by removing the lymph nodes entirely. This pathway treats the cancer as a structural problem. Total containment of the disease takes priority over preserving tissue. Because a mastectomy removes so much tissue, patients have the option to undergo breast and nipple reconstruction. This step is entirely dependent on the patient's personal preference. This diagram shows the two main options for rebuilding volume. On one side, surgeons can insert synthetic silicone shells, and on the other, they can relocate the patient's own organic volley fat. The surgical team can perform this reconstruction simultaneously with the tumor removal, or schedule it as a separate surgery later on. While the primary surgeries remove the tumor, the reconstruction phase addresses the anatomical aftermath, aiming to restore the patient's physical form. Once the work is done, the surgical wounds are closed with sutures, and the patient is transferred to a recovery room to wake up from the anesthesia. For a standalone tumor removal, the hospital stay is brief. Most patients are discharged on the same day. Looking at this chart, you can see how reconstruction changes the recovery timeline. Adding that secondary procedure right after the tumor removal typically extends the hospital stay by 1 to 2 days. The scope of the surgical intervention dictates the scale of the patient's immediate recovery timeline. Through tailored surgical technique, medical teams neutralize these abnormal growths by matching the intervention to the scope of the disease. These two pathways represent a choice between targeted precision to preserve the breast or total removal to physically block the cancer's transit through the body. If you have questions about these procedures or want to suggest a medical topic for a future video,